Well, welcome back to NTV News First Edition. Well, this weekend we will be rolling back the clocks, which means we're going to get a little more darkness in the evenings, a little less light, and of course our days will be an hour shorter. So this week in Get Psyched, Dr. Janine Hubbard joins us to talk about how the seemingly harmless time change can have a real effect on some people's mental health. So, Dr. Janine, this isn't the first time we've spoke about this, but it's always a very important topic this time of year.
It is indeed. Well, and because, listen, none of us enjoy suddenly having to spend more time in the dark and it suddenly being cold and having to go digging up the mitts and the toques and the boots. None of us enjoy that. But what we do know is that for a percentage of the population, right around this time of year, they start to have an onset of a series of depression symptoms that can either be mildly impairing or severely impairing that then lift dramatically in the spring. Used to be known as seasonal affective disorder. They renamed it a couple of years ago to depressive disorder with seasonal pattern. If you talk to somebody and say, I think I have seasonal affective disorder or SAD, they'll know what you're talking about. Or the winter blues. So about 15 to 30% of us experience it to a certain degree. And like I say, about 2 to 6% of the population, it's actually a really significant form of clinical depression.
And that's, it's kind of alarming, I guess, because that's a lot of people when you think about that have some sort of, it has some effect on their mood. The less sunlight, the colder temperatures. We're feeling it today, as Eddie spoke about in the weather. Some areas, seeing the coldest temperature since April today. So how do we, we can't control the weather. So how do we treat it?
Well, partly you look at the symptoms. A lot of them are what we all do, kind of winter hibernation. You spend more time at home. You don't want to go out. You're often kind of grouchier. The big thing is increased craving for carbohydrates. Again, there's a reason we have all that winter comfort food. And what we think is going on is the amount of light, natural sunlight that we're receiving in the winter is lessened, and that affects both melatonin and serotonin, which are neurotransmitters in our brain that affect things like our mood and our sleep. So some of it's what we call behavioral activation. You don't feel like going out, you don't feel like exercising, pushing yourself to do that, saying, yes, all right, I will go socialize. Yes, I will make social plans. Yes, I will get out. Biggest thing is, if it's sunny outside, get outside. The more exposure you can, bundle up, get out there. Your dog will appreciate it. Some people find that taking vitamin D supplements can be helpful. I always make sure check with your physician or your pharmacist because they can interfere with some medications. Some people find it helpful to use a light therapy device, whether it's a dawn stimulator on your morning alarm clock or it's just a little device that you have going beside you while you have your morning cup of tea. All of these are things that actually can really work to help counteract some of the winter blues. And
I know sometimes, if that doesn't work, if you're in a place where you're just really can't get out of bed and it's really affecting you, as you said, you can go to your doctor with this. Yep. This is a recognized disorder, and there is some treatment and help available.
There's both medication and or therapy, and what you want to do is reflect back and go, you know what, this is something that happens to me every single year. And it really does seem to be impairing, not just the, oh, I don't want to get up and go to work, but I'm really struggling to get through my day. Reach out because, like I say, there are very effective treatments out there, including all of those behavioral things that we talked about. Like I say, the best thing possible, listen, if it's in the budget and there's chance for, some tropical sunshine, that's incredible. But fortunately, we do get enough bursts here of daily sunshine that if you can take advantage of it. And you know what? Like I say, your pets will love you for getting outside and getting some fresh air and exercise. If not, follow their advice. Get outside as much as you can. And if you're cooped up inside, find a sunbeam and just kind of chill out and enjoy it there.
That is great advice from man's best friend and woman's best friend. Thank you so very much, Dr. Janine.
Thanks again.
We'll see you next week.
Absolutely.